Have you ever wondered about the potential risks of accidentally ingesting a nicotine pouch? Today we're going to delve into the case of a 14-year-old male who found himself in this very predicament. He accidentally ingested a Zeep nicotine pouch, leading to an immediate bout of vomiting. Now he's alert and oriented, showing no further signs of distress. But what's interesting here is the number of unknowns. We're unsure of the exact concentration of nicotine in the pouch. Estimates range from 3 to 7 milligrams. And while our patient seems stable now, we can't ignore the potential risks. This case presents us with an opportunity to understand the potential dangers and the appropriate management of nicotine pouch ingestion. So, let's dive in and explore what happens when a seemingly harmless action turns into a medical case study. Nicotine toxicity, what is it really? Let's dive into that. Nicotine toxicity, also known as nicotine poisoning, occurs when you have too much nicotine in your body. It's most commonly caused by an overuse of tobacco products or nicotine replacement therapy. But as we've seen in our case study, it can also happen if someone accidentally ingests a nicotine pouch. The symptoms of nicotine toxicity generally fall into two categories: early and late symptoms. Early symptoms typically include nausea, vomiting, increased salivation, and abdominal pain. Late symptoms, on the other hand, can include rapid breathing, increased heart rate, high blood pressure, and even seizures in severe cases. The severity of nicotine toxicity is influenced by several factors. The most obvious one is the amount of nicotine ingested. For instance, a single cigarette contains about 1 to 2 milligrams of nicotine, but only about 1/10 of that is absorbed during smoking. In our case, the nicotine pouch had an estimated 3 to 7 milligrams of nicotine, which is significantly higher than what you'd get from a single cigarette. Another factor is the individual's tolerance to nicotine. Regular smokers tend to have a higher tolerance and therefore might not experience symptoms as severe as those of a non-smoker who ingests the same amount of nicotine. Lastly, the speed at which the nicotine is absorbed can also affect the severity of the toxicity. This is where the patient's vomiting comes into play. By expelling the pouch quickly, the patient likely reduced the amount of nicotine that was absorbed into his body, thus lowering his risk of severe toxicity. So to sum it up, nicotine toxicity is a condition caused by an excessive amount of nicotine in the body. It can lead to a range of symptoms, from nausea and vomiting to rapid breathing and seizures. The severity is influenced by the amount of nicotine ingested, the individual's tolerance, and the speed of absorption. In our case, the swift emetic response likely limited the absorption of nicotine, reducing the risk of severe toxicity. However, careful observation is still required. So, how do we determine the risk level and potential severity of poisoning in such cases? Well, it's a multi-layered process that involves understanding the nature of the toxin, the amount ingested, and the patient's physical response. Risk stratification is a crucial step in managing poisoning cases. It's essentially a process of categorizing patients based on the potential severity of their condition. In our case, the patient accidentally ingested a nicotine pouch and quickly vomited, which likely limited the amount of nicotine absorbed into the bloodstream. This swift emetic response, combined with the patient's current asymptomatic status and stable vital signs, suggests a mild to moderate risk of nicotine toxicity. But what does mild to moderate really mean? Let's break it down. Mild nicotine toxicity might involve symptoms like nausea, vomiting, and increased saliva production. In more moderate cases, we might see signs of central nervous system stimulation, such as restlessness or even tremors. Severe nicotine poisoning, on the other hand, could involve seizures, respiratory failure, or even cardiac arrest. Now let's apply these principles to our case. the concentration of nicotine in the pouch our patient ingested is estimated to be 3 to 7 milligrams. Given his response and current condition, it's unlikely that he's absorbed a dose high enough to cause severe toxicity. The amount ingested appears to be below the threshold for severe toxicity in children, particularly given the prompt emetic response. However, it's important to note that the exact concentration of nicotine in the product is unknown. This uncertainty warrants a cautious approach. Even if the risk of severe toxicity is low, we can't entirely rule it out. Therefore, continued observation and monitoring are essential to ensure that the patient doesn't develop any delayed symptoms of nicotine toxicity. Despite the low likelihood of severe toxicity, the unknown concentration of nicotine warrants a cautious approach. While we can make educated guesses based on the available information, it's crucial to remember that every poisoning case is unique and requires a tailored approach. What steps can we take to manage and prevent nicotine toxicity? Let's delve into the action plan for our patient and discuss how we can potentially avoid similar incidents in the future. Firstly, observation and monitoring are critical in managing nicotine toxicity. We need to keep a close eye on the patient for at least 4 to 6 hours after exposure. This time frame allows us to monitor for any delayed symptoms, such as an increase in heart rate, changes in neurological status, or further gastrointestinal symptoms. Given the nature of the product ingested and the potential for delayed absorption, a conservative approach to observation is recommended. Next, we have symptomatic treatment. We need to provide supportive care for any emerging symptoms. Considering our patient had a bout of vomiting, hydration may be necessary. Moreover, any persistent abnormalities in vital signs or developing more severe symptoms should prompt further management. We need to discuss the symptoms of nicotine toxicity to be aware of in the future. This step is crucial in prevention and ensuring such incidents do not recur. Before we send our patient home, we need to establish some discharge criteria. If the patient remains asymptomatic or shows improvement after the observation period, without the development of new or worsening symptoms, it would be safe to discharge them. We should provide instructions for what symptoms to watch for and when to seek prompt medical attention. However, there are situations where admission may be necessary. If the case develops persistent vital sign abnormalities, seizures, altered mental status, or muscle weakness requiring further medical management, hospital admission should be considered. Remember, prevention is always better than cure. It's crucial to educate patients and caregivers about the risks associated with nicotine products and the symptoms to watch out for. Thanks for watching. Take care.